My name is Dr. J. Lucas. I'm a board-certified plastic surgeon. Welcome to the Lucas Center for Plastic Surgery in Knoxville, Tennessee. Today we're going to do some demonstration of Galderma products. One of them being a neuromodulator called Dysport. The principle of that product is it's a derivative of the botulinum toxin, and it is used to selectively block some of the nerve transmission to muscles to eliminate some of the overactivity of the muscle, which can lead to some fine lines and wrinkles around, such as the forehead, eyes, and mouth. Our demonstration on this young lady today is that we were going to try to help with some of the fine lines around the eye itself. The other thing that she's in her 50s, and she would like to soften the eyelid cheek junction where the bags of her eyes seem a little prominent, which can give you a fatigued look. The nice thing about Restylane, it is a hyaluronic acid, is a product that is naturally in our body anyway, but it's a nice substance that is like a caulking agent to a degree, and it allows me to add some volume at the cheek-eye junction, and it is sort of like photoshopping an eye bag away in a portrait. So that's one of the things we're doing today. Another thing that we have done previously on her is she has multiple areas of some volume loss that occurs naturally with aging, and the fat in her face is not a sea of fat, it is in discrete packets. And one of the earlier ones that begin to diminish is a cheek fat pad right here. We have already started a sequence of another product that Galderma offers. It is Sculptra. And Sculptra is an induction agent that allows us to induce her own body to make collagen, to substitute collagen volume for the fat loss. And so we would place that, we have placed one treatment in here, and it's another nice area is a lot of women begin to lose some volume in the temple area, and when you lose volume here, that causes the brow to fall down. So we often will add that product into this area and here, and I think that is a nice advantage. We also have a product which is another type of hyaluronic acid called Lift by Galderma that you could add in here as well. But I find that if you are, from a financial standpoint, if you're trying to fill multiple areas, I find that Sculptra is a better economic value for the patient. The other thing that we are going to bring up today is she has another common area where we lose volume over time, and that's in our mouth area. And what I say is that you tend to find that the lip, which initially has a nice three-dimensionality to it, begins to become much flatter. You start seeing loss of these nice columns called philtral columns. Your Cupid's bow point becomes diminished, and also women who use lipstick find that the lipstick begins to run up those lines. So today we're going to use a multi-product approach to improve our outcome. One we're going to be doing is using Restylane to define these philtral columns, because I want a little substance there, and that material helps to lift the tissue and hold its place. I also will use that in the Cupid's bow and in the junction of where the pink lip and the regular lip meet. And that outlining will help, one, contain the lipstick that you're wearing, and it will also begin to re-expand the lip and begin to soften these little vertical lines that happen. Another thing I'm going to do to try to minimize some of these vertical lines is to also offset the muscle activity of this circular muscle, and we do a symmetric weakening of that motor function in both places. That way you don't have an asymmetry to the mouth when you're in animation. The other thing we're going to do as the sculptor begins to lift this cheek, these will be less apparent, but we can use another version of hyaluronic acid by Galderma called Define. And Define will allow me to lift up some of these creases a little bit. So we'll soften some of those lines. The other one what we're going to do is another product which is a very light body hyaluronic acid called Silk. And that will add just a little bit of volume where there's been a loss of the subcutaneous fat between the skin and the muscle itself. And then there's also a Refine product, which is sort of an in-between, and what I will use is to run up some of these vertical lines. So it's sort of a multi-dimensional approach to adjusting some of these problem areas on a face. So we're going to start with the regular Restylane, and I tend to like my patients in an upright position. I will bring her back slightly. Upright position than if you're laying down. And my regular Restylane is here. I've already disinfected the face with alcohol, an important step because we don't want any type of biofilm to get on any of the product when we're injecting it so that you could have a foreign body reaction. So this is a area that should not be done by an untrained individual. I personally think only a physician should do this area because there are a lot of blood vessels, and particularly the veins which don't have any valves. If they get inadvertently injected into the vein, it can go retrograde and lead to blindness. If you have a good sense of the anatomy, I'm operated on all parts of the skull, face, eyes, and I'm very comfortable with the anatomy, and I will not cause a problem. But to an untrained individual, this could be a detrimental thing. So when you are doing this injection, you must stay underneath the orbicularis muscle. If you get because the plane between the muscle and the skin is so thin, you could feel imperfections, you could feel nodularity, but when you inject deep in this plane, then you won't feel the product at all. Never had a problem. One of the anatomy points is basically the mid-pupil area right underneath the rim is where you have a big blood vessel and nerve supply coming out and spanning over the face, and we'll stay away from that. And then there's also blood vessels coming off of the ethmoids right here. So these are critical areas that you must be cognizant of when you're working on it. So it can be a little off-putting at first because I'm going to touch the bone. And I will say we always topicalize everybody and ice them before we do the surgery or this procedure. And the important thing is we keep the needle moving at all times, so we're not going to inject the vessel. And what we're going to do here, I'm going to go to the other side of that nerve and blood vessel, and we're going to go up in what's called the tear trough area. And what we can do is you can see how that just gently fills that space, and then I can massage it because it's a very malleable material at this point. And you can see that it begins to smooth away that transition zone. Once again, I come out here again, that's not as vascular, and I fill that space. You can actually see that pop, that kind of the junction of the orbital septum and the bone. Now, I did a little more volume on that side. I think that won't cause too much trouble. I'm going to probably need one more syringe for the other eye. But I think if you see where she started and where she is now, I can certainly put more product in. I just find that the more I inject, the more swelling that can occur in about 24 to 48 hours. So I generally say about a half cc, which is a half of a syringe, to do this. But you can see that that softens that eye pad. I think it looks quite natural, and it gives a much more rested appearance for the patient. Another rest. All right, so I'm going to go to the other eye. Just going to blot it off one more time. See a little touch. Jackie's a trooper, but most people do not find this overly uncomfortable. The other advantage of Restylane over, say, another manufacturer's product is that it is not what's called hygroscopic, meaning it won't draw in water and gain volume to give you puffiness. And so I would say that this is a preferred filler agent for around the eye compared to some of the other manufacturers' products. And as you can see, if done well, you should not get a lot of bruising. And I also find that the over volumizing at the first session will also lead to more swelling and bruising. So even though it's not corrected 100%, I'll have her come back for that later. Okay. Feel all right?
Okay.
All right. Now, while we're up around the eye, I'm going to do the other thing that we talked about, using the neuromodular medication of Dysport. And where I'm going to be making the circular muscle, which acts as a brow depressor and also is used for forceful closing of the eye. If we break up that circle, it will get rid of these finer lines, and if we come up a little bit higher, we can actually get a little subtle brow lift. And I go very superficial, also being mindful of the anatomy of where the blood vessels are. So this is a combination of, it's going to soften lines that emanate from that muscle and also give her a little bit of a brow lift. I'm going to go to the other side. So as I said, the most important thing in any of these products is to do a proper facial analysis and determine what is going on in terms of the anatomy and what is going on in terms of the aging process, and trying to eliminate that. And it's not a one cannon kills everything. It does require the understanding of the subtleties of the various products to get you the best result. Okay, so there we go. We've kind of worked on the eyes. Now I'm going to go and lay her down. All right, Miss Jackie, I'm going to have you lift your head up. Put your neck down. I'm going to put your feet up. Problem with a live presentation, we can't do a cut and stop and resume. All right, lift your knees up for me. All right, now I'm going to lay her down. Okay. Now I'm going to have you slide all the way up like in the dental chair. There you go. You're doing great. You comfortable?
I am.
All right. So, the one thing I'm going to do first, before I start adding the other injections, I am going to use this Dysport, the neuromuscular modulator, to weaken a couple, and maybe if you can zoom in here, you can see there, pucker your lips like you're going to kiss. There is strong muscle activity here, 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 and here. So I'm just going to put 1 unit in each of those areas just to subtly weaken the muscle and allow that not to be such a promoter of those deep grooves. And you can see that it's just a simple little pinch. And as I mentioned, Botox, I generally don't anesthetize anything anyway, because the needle that we use is the same size as an insulin syringe. And so we don't generally need to anesthetize. But since we already did topicalize, it makes it even less obnoxious. Now, the next step in our process is I want to make a 3-dimensional lip out of a 2-dimensional lip. Right on. So the first thing I want to do is restore these filtral columns. And I actually want a 27. So this is regular Restylane. So I'm going to enter right where the Cupid bow point is, and it angles up to the base of the nose. I want to do it fairly superficially, and we're giving her definition of that column. She does not want a big lip. She wants a natural lip. I don't like to have lips that look like they come out of Beverly Hills Real Housewives. I mean, those are abnormal. They don't look normal. But I want to give her a nice natural appearance that she can feel refreshed. Then, so I've got these columns restored, and then that also is occupying volume, diminishing lines. Then I go to the Cupid's bow high point to the low point on the right side, create a convexity. Then I go to the left Cupid high point to the low point, create some convexity. And then she already has a bit of a tubercle, so I'm not going to enhance that any more than I would normally. Now what I'm doing, and this is called the Vermilion cutaneous border, it's a very defined subunit of the lip, and I'm adding this filler agent like a caulking material. It's going to soften those vertical lines. It's going to create a crisp angle, which is lost with the aging process. I'm going to put just a little bit more in this bow point. Then I go to the other one. I use a 1.5 inch needle so that I can do the entire length of the lip in one injection. See, I'm able to create some definition there. Now I'm going to do the lower lip. Once again, you don't have to blow the lip volume up to achieve the results that you're looking for. I have a lot of women go, oh, I don't want to have big duck lips, and you shouldn't have to. you're beginning to see that we've given there some more of a three-dimensional appearance to the mouth. Now, the next step that I'm going to do, open your mouth, I'm going to put a little bit of the volume in the corner of the mouth, and that helps to offset some of the downturnings of the angle. Okay. Now the next material I'm going to use that's silk. I'm gonna put just a little bit more in here. Get a little bit more that I see with the rest of them. Another thing, people always ask, well, what if I don't like what you did? The nice thing is that since this is a natural substance in our body has all sorts of equalizing reactions. There is an enzyme called hyaluronidase, and it can liquefy this and make all of this disappear at a blink of an eye. So, we've got our initial three-dimensionality of this. And as I said, a lot of people, I need to reestablish this central tubercle. I don't think I need to on her because she has some of that already naturally, and I don't need to expand upon it. I'm now going to use a softer filler agent called Refine to then go into some of these lines. And it's a little bit of a nice softer body to fill in these little places. And I inject pretty superficially. See how that one got much less. Turn your head this way. We're going to inject here. See that the areas where we were injecting. Okay. Now, in looking, I might still go back to my regular Restylane again. I want to accentuate this column just a little bit more. These are not parallel lines, they are convergent up to the nose. You make them parallel, then they're not anatomically correct and it'll look odd. Okay. Little bleeder there. I'll close this off quick. Alright, now we're going to go to the heavier body. Define that I can layer where some of these, let me have you lift your chin up. I don't in general inject like cheek folds. I try to soften cheek folds by resuspending the face with either the lift material or with Sculptra. But in these cases of these finer, kind of deep entrenched lines here, I could soften them a little bit. Because in general, all of us have a cheek fold line, even when we're in our young age. And she has sort of a subtler lower jaw compared to the upper, and so she has a little more demarcation of this line because her tooth support is further back than her chin. A little bit right here. Now another thing that we do at the Lucas Center to help with these lines is to improve the skin tone, and we use microneedling. We use the Eclipse system, and my esthetician does that, and it's a sequence of treatments, and it makes the tone of the skin better so that your lines begin to fade a little bit as well. So that's treating the more superficial skin and making it that it has some compliance that will have some snapback effect. I'm going to put a little bit right here to lift the angles of the mouth just subtly. So the lip will inevitably swell a little bit while I've done this procedure, so it's a little bit slightly puffy right now, but that over the course of about 24-48 hours ought to get better. And as you can see, she could still go out and return to work. And the nice thing about these little techniques, you can see that we've softened these lines, and it will allow her to be able to wear makeup, such as a lipstick, and allow her not to have the lipstick roll up onto her lines. So, like I said, ultimately, some of these lines will be best served with the resuspension of the lip, of the cheek, with the filler agents. But I think that you can see that we've given her some more three-dimensional effect by enhancing these lines, enhancing the Cupid's bow point, enhancing the what's called the Vermilion cutaneous border, and I think it's a nice subtle result that gives a refreshed appearance to the mouth, and I think her eyes will have a more of a softer appearance with the fat pads, and then as the disc port begins to work, it will help soften the fine lines around the eyes themselves, and then also hopefully minimize the animation activity that results in those vertical lines of the upper lip. So I hope you enjoyed our demonstration of some of the Galderma products that we use at the Lucas Center, and we're located in Knoxville, Tennessee. If you have further interest in our center, feel free to look at thelucascenter.com.